Is virginity something you can see or prove? What does the hymen actually tell us? In this medically accurate and myth busting video, we explore the so called anatomy of virginity, a concept rooted more in cultural tradition than scientific fact. This video breaks down the anatomical structures often associated with virginity, primarily the hymen, while explaining why virginity is not a physical condition, but rather a social and personal concept. You'll discover how common beliefs around virginity and the female body are deeply flawed, and how modern science can help replace shame and misinformation with knowledge and body literacy. What you'll learn in this video. What is the hymen? A thin, elastic membrane located at the vaginal opening with a variety of normal shapes: crescent, annular, septate, etc. It does not seal the vagina, and it often doesn't tear or bleed during first intercourse. The myth of virginity. Virginity is a social construct, not a biological fact. There is no medical test that can prove if someone is a virgin. Can the hymen break? The hymen can stretch or tear from many non-sexual activities: cycling, gymnastics, tampon use, even normal movement. Some people are born with very little hymenal tissue or none at all. First-time intercourse. What actually happens? For some, there may be discomfort or minor bleeding. For others, there's no pain or change at all. Pain during first sex is more often due to tension, lack of lubrication, or anxiety, not breaking anything. Virginity testing and its harm. Widely condemned by WHO and human rights organizations, it's scientifically invalid, medically unethical, and psychologically damaging. Why accurate education matters. It dispels dangerous myths, empowers bodily autonomy, and promotes respectful sexual health. Did you know? The hymen is part of normal vaginal development during fetal life and has no known biological function in adulthood. In some cultures, bleeding on the wedding night is wrongly expected as proof of virginity, but this happens in less than half of first-time intercourse cases. Hymenoplasty, or surgical restoration of virginity, is a growing and controversial practice with no medical basis. Key message: virginity has no anatomical marker. The hymen is not a seal or proof of anything. Education is the key to breaking the stigma, fear, and shame many feel about their bodies.